there has always been within any health service a desire to create health efficiencies and to try and provide services as efficiently as possible. But one of the most amazing things was back in, even in the late 60s, early 70s, when people started trying to motivate people towards doing more ambulatory care. There was the real benefit shown for actually getting patients through the system. And that's really important these days with health services, because as we've seen probably from about 2009, 2010, we've seen a huge reduction in the available spending for health services across most countries in the world. So outside of Korea and perhaps North America to a degree, we've had real falls in or levelling off of funding levels. And if you think about the rate of inflation, health inflation, any standing still in the health budget is actually a fall. We've seen the rate increase over the last decade, and the rate of increase varies across OECD countries. If you look at the UK, where we've put the British Association of Day Surgery has worked with the commissioning bodies to try and incentivise trusts to move towards moving procedures into the day surgery arena, then we have seen massive increases in day surgery. So we're heading towards the 70-75% of elective surgery being performed as a day case. I think it's an important aspect to moving things forward in the subspecialty of urology. We have the British Association of Day Surgery, and our perceived wisdom is that could move things perhaps towards the 75% mark of cases being done as a day case or ambulatory care case. And I think you have something that is a technology that allows hospitals to move a large number of patients from what was an inpatient 2 or 3 day stay procedure to an outpatient or a day case pathway. The potential saving on those from those overnight stays, the reduction in overnight stays, is huge. But actually, if you understand the pressures that there are on hospitals, particularly in the UK, we have real problems with bed numbers and trying to get patients in for inpatient surgery. If you move your patients into day case surgery, you know that you're going to get them done. So as a surgeon, it gives you confidence that you're able to offer the patients the treatment that you are wanting to give them, as opposed to coming in on a Monday morning to find your list decimated because there are no inpatient beds. But the final thing for me is it's about quality for the patient. And that's the really important thing. What we're about in the International Association for Ambulatory Surgery is quality day case care. And I do believe that teams using GreenLight technology can provide quality day case surgery for this group of patients. The team members, they're all very important. If we follow the pathway, then straight from one of the major team members, after the surgeon has decided that patient requires surgery, is the pre-op assessment team. Because that pre-op assessment team sets the scene for the patient. And if we're going to have a successful day surgery pathway, it is important that the patient and the carer has the same information repeated each time they're visiting, so they have it reaffirmed. We know that patients forget a lot of what they're told at any one consultation. And one of the important things about the pre-op assessment is it actually reinforces to the patient and the carer what is going to happen. So the pre-op assessment team is a vital part of it. Then you move into the ambulatory care nurses who are looking after the patient pre and post-op. And again, they're vitally important. And that consistent message that you are not an inpatient, you are not a patient as in you are going to be in a hospital bed and need to stay in a hospital, is an important message to reaffirm all the way through. If there's a chink of weakness in that, you find that patients will end up being admitted. If someone says, oh, we better book a bed in case, that patient loses confidence in what is happening. So it's very much about building the confidence of the patient. And then moving into the theatre team obviously is vitally important as well. The anaesthetist tends to run through that whole team process from pre-op assessment to the pre-op care, to the theatre, to the post-op care, I would suggest is an important part of that process. And if you have a well-motivated anaesthetist who helps look after that process and ensures that your patients are comfortable on discharge, you will be much more successful.